Having incompetent people running ZAMSA has led to lack of drugs in health facilities, despite a government releasing over 6 million kwacha for the procurement of drugs.
Thank you. We need to know very well that as we are talking and as we are where we are standing right now, there is no any institution in the country that can come and say that they have medication, and these institutions are public institutions. So the members of the public are moving from one place to another without finding the drugs in the hospitals, and this is bringing a lot of panic to members of the public. Not only that, on the other hand, the government has released about 657 million kwacha for the procurement of drugs, but due to incompetency at the management and ZAMSA and the management not knowing what they are supposed to do, we have subjected the poor Zambian people to these stockouts of the drugs and shortages of the medication, and they have been put on record and have been speaking to say the interim management at ZAMSA has no capacity to sort out the problems, and what was needed to be done quickly by the board at ZAMSA is to make sure that they put up a very credible management that is going to start sorting out and dismantling problem at ZAMSA as compared to the way it is. But unfortunately, what did we see? We saw the incompetent management being put in place. For example, how do you have the management that deals with procurement, distribution, and manufacture of drugs without any professional that is at the center of this manufacturing? That's very much unacceptable. How can you have management without a pharmacist in it? That's something very much unacceptable. And what is happening? The Zambian people, the members of the public, are the ones who are suffering. The members of the public are the ones who are going to the hospitals without getting the medications. And now we are having people dying in hospitals due to lack of these medications. Well, the government of the Republic of Zambia have so far released the 657 million kwacha, a huge amount of money for the procurement of drugs. But due to incompetence of the management at ZAMSA, there are no drugs in hospitals. I think seriously overall at Ministry of Health need to be done quickly so that we can serve the Zambian people. Thank you.
Meanwhile, Medical for Quality Healthcare in Zambia, MQHZ, has expressed disappointment over the shortage of some essential drugs in almost all public clinics and hospitals countrywide. MQHZ Director General Dr. Queens Mwabo says a survey conducted indicates in the last 2 weeks most essential drugs have run out, a situation that has caused many to receive prescriptions. Dr. Mwabo says health institutions are now more consultancy center, adding it is an assault on the drive for universal health coverage. He says the Ministry of Health must be held accountable over this very unfortunate situation.
We are very disappointed, as I said, with the critical shortage of drugs in the hospitals and clinics. And this is very sad, and it's an assault to the drive of universal health coverage in the country. And the Ministry of Health, through Zambian Medicine and Medical Supply Agents, they need to be held accountable for this very unfortunate situation, because people are dying in the community because there is no drugs in the hospital and clinics, and they are failing to access these drugs in the hospitals and clinics, and it's very unfortunate. And the Minister of Finance, they have already funded the Zambian Medicine and Medical Supply Agents to procure drugs for the people of Zambia. But there is still a shortage of drugs in the hospital and clinics, and it is worrying. So we challenge the Zambian Medicine and Medical Supply Agents to procure drugs for the people of Zambia as quickly as possible before the situation gets worse. People in the rural community, they are dying because of this situation. So drugs must be in the hospitals and clinics without any excuse, because if we continue in the same situation, it will be very bad, and we are going to lose a lot of lives. So we need urgently the drugs and other medical supplies in these clinics and hospitals.